Good day, welcome to my YouTube channel. All claims expressed in this slide presentations are solely mine and do not necessarily represent those of any publishers, editors, and or reviewers. Any product claims that may be made by the manufacturer is not guaranteed or endorsed by me. No copyright infringement is intended. No part of this YouTube video may be reproduced, stored in a retrieval system, or transmitted in any form or by any means except as permitted under the U.S. Copyright Act without the prior consent of the creator. While my best efforts are used in preparing the content for the site, I make no representations or warranties with respect to the accuracy or completeness of the content of the videos, including any contact links or resources shared, including those by third parties. Furthermore, all parties specifically disclaim any express or implied warranties or fitness for a particular purpose. The advice or strategies contained herein may not be suitable for your situation. Given no legal advice is being given herein, you should consult with a professional where appropriate. No liability or damage shall take place because of this content. Today, I'd like to talk to you all about minimal change disease, Graves' disease, and methimazole. Hello, I'm Lisa, a 54-year-old African-American female. I was diagnosed with Graves' disease about 5 years ago, and I'm beginning to take methimazole to manage the disease. What is Graves' disease? Well, Graves' disease is an illness that affects the thyroid gland. It's hyperthyroidism, which regulates metabolism and other physical functions. Some of the symptoms of Graves' disease would include heart palpitations, dramatic weight loss, bulging eyes, eye problems, skin irritation, goiters, and sensitivity to heat. The treatment is aimed at correcting the hormonal imbalance, and it may take some time before the symptoms of Graves' disease are eliminated. I am not the typical picture of Graves' disease. I do not have the bulging eyes. I am not thin. I'm obese, and I was not sensitive to the heat. I'm very sensitive to cold. While I experienced some of the symptoms, I did not experience them all. The symptoms that I mainly experienced were the heart palpitations. We'll talk about that a little bit later. I had a routine visit with an endocrinologist earlier during the year. He mentioned that based on my labs, I could be going into remission, which is a good thing. At that time, my skin was dry, my nails were brittle, I was cold all the time. My blood pressure was also low. Keep in mind, I mentioned earlier that the heart palpitations, I was on a beta blocker, which is a blood pressure medication to reduce your heart rate and other symptoms. And actually, the symptoms that I was experiencing was more of hypothyroidism, which can occur when you're being treated for hyperthyroidism. By mid-January, I called again expressing my concerns, and I wanted to talk to the physician. At that time, my physician was out of the office, and the on-call physician felt that it's something that could wait. It was not urgent. It could wait till you return. So I decided to stop taking the medication just based on how I was feeling, because it was just making me feel just awful. So a few weeks later, I did get an opportunity to meet with my physician. And keep in mind, I'd already stopped taking the methimazole for at least 2 weeks. My labs were actually looking good. The TSH and the T4 were within normal limits. For those of you that don't know what that is, I will be talking about that a little bit later. I did inform the endocrinologist that I had not been taking the medication, and his response was he really could not tell what was going on, and that he would like for me to continue to prescribe strength. And I'm thinking, what? I'm not taking anything. There is no strength. I did resume taking the medication. But I noticed that my feet were swollen, and I noticed bubbles were in my urine at this time. And these were some of the symptoms that I had prior to discontinuing the medication. I had the swelling of my feet at that time. So the bubbles in my urine, that was just, I was also mentioning that, I'll also go ahead and mention that I was watching my weight, so to speak. I was exercising at least 3 times a week for at least 30 minutes. I was also eating healthier in an attempt to lose weight, and I'd actually been at a standstill for some time, and that was concerning to me as well. And not only was I at a standstill, now we're taking it to another level. Once I start taking this medication, I noticed the scale creeping up, and I thought, now I know I snuck a piece of and ate a piece of cake the other day, but ain't nowhere in the world that was 5 pounds of cake, because we were gaining that. I was gaining weight at a rapidly. Okay, let's go on. About first week of March, I requested a thyroid function test. And my T4 at that time was 0.81. My TSH was 3.049. I notified the MD of my labs because I did not have them taken in the office. I went somewhere else to have them taken. I told them about my lower BP, my lower blood pressure, my lower extremity edema, and my current dose of methimazole. Now, he gave me orders at that time based on the labs and the symptoms that I was experiencing to just decrease the dose. He explained that the TSH was in normal range, so therefore he would decrease the dose rather than discontinue it. And if the TSH was elevated, then he would stop it completely. Let's talk about the TSH and T4. The TSH is your thyroid stimulating hormone. It's produced by the pituitary gland and signals the thyroid gland to produce hormones. These hormones control metabolism, mood, energy, and weight. The normal TSH value ranges from 0.5 to 5 microunits per milliliter, but of course those ranges may vary by labs. And then we talk about the T4. The T4 is your thyroxine. It measures the amount of thyroxine in the blood. The T4 is produced by the thyroid gland. It produces numerous enzymes that produce energy for the body. The normal T4 range is 4.5 to 11.2 micrograms per deciliter. But again, that range may vary by labs. I call the endocrinologist again. I did not receive a response as soon as I would have liked to receive, so therefore I decided to go to urgent care. My symptoms were worsening, and I was diagnosed with protein in my urine. They referred me to a nephrologist, and that referral was several weeks away, and also urinary tract infection, which I was treated with the antibiotics. And you can see those T4s was 0.76, the TSH was 3.786, the albumin was 2.8. Now, that is concerning. When your albumin is going down, that's an indication that definitely that something's not right. It's having rapid weight gain. I was gaining 2 to 4 pounds per day. Experienced generalized edema. Was belching a lot. By the end of this week, I had gained approximately 13 pounds. That's a lot. Okay, the next week, because I'd already been to the doctor, received the treatments there with a referral to the nephrologist. I was just very concerned about my health, so I decided let me go to the ER. So I was diagnosed with nephrotic syndrome. I was spilling more than 20,000 grams of protein in my urine. The attending physician did agree that I need to be seen as soon as possible by a nephrologist, and she said that she would call them, and she did, and was trying to get me in as soon as possible. She also suggested that I call. I did more than that. I decided to go to the office the next day, and thank God when I got there, they actually had a cancellation while I was there, and I was able to be seen that day. I did have to leave and come back to the office, but I was just fine with that. I was just so grateful. Within a few days of my ER visit, I called and spoke with my on-call endocrinologist, and she finally said to stop taking the methimazole. What I could not understand is through all of these signs and symptoms, and I felt that it was related to the methimazole. That's what I felt. No doctor in the ER, no nurse practitioner at urgent care, no one would say, stop taking this methimazole for right now until we can figure things out. No one said that. They wouldn't touch it. But I finally got someone say, just stop taking it immediately. Okay, when I met with the nephrologist, it was just so good to just be able to sit down and talk with him. We discussed my treatment plan, and I was admitted to the hospital within a few days of meeting with him, probably within 2 or 3 days of meeting with him for evaluation and treatment. My hospital length of stay was 8 days, and during that time, um, probably gained another 15 pounds. I think by the time I was admitted to the hospital, I already gained anywhere between 30 to 40 pounds. And this is all within a month's time. So that's quite a bit of weight. During the hospital, they did urine tests, blood tests, kidney biopsy, um, checking my heart, ultrasounds. They ruled out lupus. What they did find was I had proteinuria, elevated lipids, and there was my albumin level was also very, very low. Now, in testing, I'll go ahead and mention they do the blood test they do for syphilis and HIV because there is a link between minimal change disease and those viruses, new exposure to those viruses, I should say. Thankfully, I was negative on both of those counts. However, I was diagnosed with minimal change disease. And minimal change disease is a kidney disorder that damages the tiny blood vessels that filters blood in the kidneys. And it can only be seen under a very powerful microscope called the electron microscope. I suppose that's why they call it minimal change disease. It's the most common cause of nephrotic syndrome in children, but with us adults, it's usually it's less common and it's usually secondary, meaning that it's caused by some other related to something else, such as painkillers, NSAIDs, tumors, and infections caused by virus. And I already mentioned those viruses to you. The signs and symptoms is usually foamy urine due to large amounts of protein spilling in the urine. Remember, I mentioned that. Excessive weight gain due to the fluids in your body that is not able to get rid of. Remember the albumin that I mentioned. When your albumin level is low, you tend to have that swelling. The nephrotic syndrome is usually loss of protein in your blood, proteinuria, high levels of fats or lipids in your blood. So now you have high cholesterol. Also, now I was treated for that as well. Now, this picture here shows my lower extremity edema, and this is actually, when it looks good, it's gone down considerably. So you can imagine what it looked like beforehand. Now, while I was in the hospital, I was treated with some diuretics, we'll say loop diuretics, and I was having some complications with them, elevated heart rate, at several PDCs. My potassium and magnesium levels were also abnormal, and I was treated for that. But that's something you have to be very careful of when you're being treated with loop diuretics, or diuretics for that matter. Let's talk about albumin. The normal albumin level is 3.4 to 5.4. My level was 0.8. A low albumin level is associated with your liver, kidney, and or other serious health conditions. I received an albumin infusion twice in the hospital. It did no good as I was urinating it all out. Okay, I've got it listed at about week 5. We had the renal panel, the CBC, UA, the tacrolimus levels. Now, that was one of the medications I was placed on during the hospital stay. And it's a medication that's usually given to those that have a kidney transplant, but it's also used to treat minimal change disease. I contemplated asking about the vitamin D to assist with the respiratory and immune function. However, it could also affect the parathyroid. So I was already having some issues with my thyroid, so I thought, nope. So we met to discuss, I also wanted to discuss, the ACE inhibitors, which is a blood pressure medication that affects the kidneys and could assist with the amount of proteins being spilled. It can lessen that amount. But because my blood pressure was running low, which was, I think it's a good thing my blood pressure is low. I certainly don't want high blood pressure, but that ruled out the ACE inhibitor. At one point, we stopped the tacrolimus because it was, I could not get into a therapeutic range. I was just not responding very well to it. And so therefore we did decide to continue on with the Bumex, and we were starting to look at the steroids. Now, late April, mid to late April, the swelling decreased a little bit, labs was a little bit better, and I lost, I think, about 3 pounds. Now, the concern with the steroids was going to be the weight gain, the brittle bones, possible diabetes. We're going to be talking about that a little bit. And I already mentioned that we stopped the tacrolimus. We start the prednisone at 60 milligrams a day, 60 milligrams daily, and within a week I gained an additional 5 pounds. Now, but shortly after that, a few days after that, the swelling was decreasing. I was urinating like crazy. I mean, it seems like I was going to the bathroom every 10, 15 minutes. I was going to there frequently. It's at one point I thought, darn, I need a bedside toilet. Within 10 days of starting prednisone, all excess weight is gone. I was glory to Jehovah God. My protein decreased from 30K to 12K. Now, by the first week of May, I began to have some heart palpitations, had abnormal thyroid levels. Remember that I'm on the prednisone. These things will happen. I was seen by the endocrinologist again, but the labs were slightly abnormal, but no methimazole. He referred me for a thyroid ultrasound and to the cardiologist. Now, I'd seen the cardiologist already when I was in the hospital just a month or two ago, and everything was fine. I did go back to see him again. I had a heart monitor on for over a week, and again, everything checked out fine. So that's a good thing. Now, the journey continues. The week beginning of May, mid-May, late May, I started talking to the physician about my shortness of breath on exertion, my increased heart rate, and I really thought it was due to the prednisone. No, it was because of it was putting me into fluid volume depletion, the Bumex, the diuretics. So we stopped that for a short time, and I began to gain weight. Also, I started swelling up again. So we talked about that a little bit later, and he did place it on hold. And shortly after that, maybe a few days after that, we decided, okay, we'll just take it as needed. Now, late May, my albumin level was greater than 3, so that means the Eliquis could be discontinued. The Eliquis is to prevent blood clots. If your albumin level is low, you're at risk of blood clot. But we were going to continue that prednisone at 60 milligrams for at least 4 months, and the plan was to start to taper off in mid-August. My proteinuria by late May had decreased from 27 grams to 1.6, which was awesome. Now, at this point, I have developed steroid-induced diabetes. Now we'll move on to the next month. At the end of the next month is by June. My proteinuria had decreased from 27 grams to 1 gram, which is awesome. The weight gain and edema, well, we're still battling with that. I continue to Bumex 1 milligram twice a day as needed, if needed. With the blood steroid-induced diabetes, I'm now on the Semglee and the Lispro. And initially I was doing the finger stick blood sugars, and that was no fun. I just thank God for technology. Now we have the Libre sensors. You can use that. I don't have to stick myself so much. Okay, July, the treatment continues more or less. I have now developed moon face, and I did call the physician because I was very concerned about that. My cheeks were a little red. I mean, it seemed like it just developed overnight. Got the double chin, so to speak. I just was not very pleased with this. I had taken over a year to lose over 40 pounds, and that's a long time, but I was so proud of myself. I did it without medication. I did it by dieting and exercising, and for me to gain all of this weight, and on top of that, now my appearance is changing as well. So it's a self-image thing. I mean, there's, but if you have a choice between your moon face and your kidneys, what you're going to take? I'll take the moon face any day. I gained 13 pounds, but keep in mind did lose all of my weight at one point, but I gained some weight. So what I decided to do to try to help myself out was, okay, I said, okay, what can we do to help yourself? I joined Weight Watchers, and a few weeks back, I didn't mention this, but shortly after I got out of the hospital, one of my best friends gifted me a stationary exercise bike. So I try to get on my goal is to be on that bike, to exercise on that bike, but at least 3 times a week for at least 25 to 30 minutes. Hopefully at some point during the day that I'll feel good enough to do it, because we'll talk about that. Some days with this disease, I feel so energetic. I feel like I'm cleaning up my house, I'm decluttering, I'm just doing little tasks, small tasks, anything I can do. But then there's other times it's just like I don't have any energy. It's like the only way I could describe it to you is if you're working outside in a hot sun all day long with no water, and you come in and you're just exhausted, and all you can do is you just want to take a bath, get a cold drink of water, and just lay down and do nothing. But the thing about it is, the only thing I did was wake up, and I felt like that. So if I could say anything to anybody, if you're going through this, is when you're feeling good, get up and do everything you possibly can. Listen to your body. If you don't feel well, just take it easy. With that being said, like I said, just listen to your body. You don't want to overdo it. There are some similar cases. There was a 36-year-old woman with a history of Graves' disease that was taking methimazole for several months, and she was a edematous, and she came in with the stage 3 acute kidney injury. She was, based on renal biopsy, she was diagnosed with minimal change disease. And the sources cited in this case as well. There was another case with a 63-year-old man who was admitted to the hospital with nephrotic syndrome. He also had a history of Graves' disease. And he was being treated with methimazole and a low dose of steroids, prednisone 5 milligrams daily, There's not many cases of this. My physician told me he hadn't treated very many people, but he's aware of he has not treated very many people with minimal change disease. And again, it's uncommon for adults to have it. What he did mention is that there were, I think, 4 or 5 cases that he was aware of. And in my research, I'm finding that there were 4. I think I am the 5th case, maybe 6, that's documented that I'm aware of. So this is something that I'm very, very interested in, to say the least. So let's go back to my original question. Is there a link between Graves' disease, methimazole, and minimal change disease? Well, the conclusion is Graves' disease and methimazole use are possible causes of minimal change disease. Systemic corticosteroid therapy is a possible management. However, further basic clinical and epidemiological research on this subject is required. So, for me, initially, I'll be honest with you, when I got this diagnosis, it was devastating to me. I was scared. I was worried. I expected to just go in the hospital, get this fluid off, and just recover just like that. That did not happen. And the more I learned, I was really getting worried when I started looking at other people's cases. There's some folks, unfortunately, they wind up on dialysis. They've had kidney transplant. Their prognosis I was just like, oh my goodness. So for me, looking at all of those, it was kind of depressing to me. And I remember crying for about 2 or 3 days. And then I just got down and I just prayed about it. And I said, I'm not going to worry about this anymore. I'm going to do the best I can. And I'm going to be positive. And discard these negative thoughts. I will get better. So keep a positive mindset. Be positive. Believe that you will get better. Discard those negative thoughts. Replace them with positive thoughts. Now, there's some scriptures there for those of you that believe in God and are religious. You can look at those scriptures. I find them to be very encouraging to me during my darker moments. Um, but like I said, I try to just keep my mind positive. I try to stay busy. I try to do the things that I can while I can. Um, I hope you all find this information informative. I hope you've learned from it. And that I'm hoping it would trigger some folks to do some more research. Thank you for watching my YouTube channel.